And now it's time to focus a bit on early warning systems. And for that, we have invited also excellent list of panelists. And I'm going to start by giving the floor to Dr. Bajaj. I hope I pronounce your name correctly, Dr. Bajaj, who represents the Council on Energy, Environment and Water of India, CEEW. And we are going to hear from him about heat health integration. So with this short introduction, Dr. Bajaj, I give you the floor, and I alert also Catalina Jaime from the Risk Informed Early Action Partnership, RIP, who will be following your presentation. So over to you, Dr. Bajaj.
Great. Thank you very much, Ricardo. And thank you very much to the organizers for the opportunity to join this very important discussion and share perspectives from India, from the Council of Energy, Environment and Water. But yes, my name is Dr. Pushp Bajaj, and I work as a senior program lead in the climate resilience team at the Council on Energy, Environment and Water. I will be talking to you about some of our experience working with cities, and districts and states on building heat resilience in India. So for those of you who may not be aware, CEEW is one of Asia's premier not-for-profit policy research think tanks based in New Delhi, India. And our overarching goal is to impact sustainable development at scale through data integrated analysis and strategic outreach. Our work at the Council is divided across these three main pillars, which includes transformations, quality of life, and enablers. So under transformations, we have programmatic teams that look into aspects related to low carbon economy, energy transitions, power markets, etc. Under quality of life, we look into aspects related to clean air, sustainable water, sustainable food systems. And then enablers are sort of the cross-cutting programmatic themes that include sustainable finance, technology futures, and the team that I am representing, which is climate resilience. We are an organization with 390 plus multidisciplinary staff, and we are actively engaged in 20 plus states in India. We also have some special initiatives such as the Green Finance Center, Powering Livelihoods, and we also have a state office in the state of Uttar Pradesh in India. Now, sharing with you some of our learnings from our research and data and analysis in recent years. So these are some of the findings from our study in 2024, where we looked at the heat risk index at the district level across India. And the heat risk index we computed as a combination of several indicators. And I'm just showing here some of the key indicators that we included in the study and the results that come out of it. So on the extreme left-hand side, you see the change in the frequency of very hot days across India at the district level. In the middle is the change in the frequency of very warm nights. And in the extreme right is the change in the relative humidity across India, starting from a climatic baseline of 1981 to 2011, comparing that to the past decade of 2011 to 2022. So the study was published in 2024, where we found that, of course, the number of very hot days, which are defined as kind of the 95th percentile of temperature range, we are seeing an increase in these number of very hot days. But more importantly, there is a significant increase in the frequency of very warm nights. And that, I'm sure, as might have come up earlier as well, that is where the real health impacts kind of lie, where we understand that, for the populations that do not have access to cooling, air conditioners and other cooling technologies, and are, living outdoors or in, less privileged environments, it's the night time that allows the bodies to cool down. And if we are witnessing an increase in warm nights, that actually does not allow the body to cool down, and that can lead to significant health impacts. Another observation was that relative humidity is increasing in several parts around the country, which again adds to the heat stress and the wet bulb temperature, which is the real problem when it comes to health-related impacts of extreme heat. Now, when I mentioned that we computed the heat risk index across India at the district level, and this was a combination of several different indicators. This is the map showing the heat risk index at the district level, where we found that nearly 57% of Indian districts that are home to 76% of the Indian population are in high to very high heat risk category. And some of these include kind of the central western portion, which are experiencing very high heat risk, and also areas in the north and the south that are experiencing high to very high heat risk. Now, if we talk about the kind of central policy instrument that is used, for action against extreme heat, these are the heat action plans that have recently started becoming a priority for many cities and states in India that are actively taking interest in developing heat action plans. And if we look at the evolution of how heat action plans evolved in India, it was all the way back in kind of 1999 when the state of Odisha along the east coast became the first Indian state to develop a heat action plan, even before we had kind of national level guidelines on the development of heat action plans. Then another major milestone was the 2008 National Action Plan on Climate Change, issued by the Government of India, by the Ministry of Environment, Forest and Climate Change. Soon after that, in 2013 and 2014, Ahmedabad city in Gujarat developed South Asia's first city-level heat action plan, and already saw benefits accruing from that in terms of avoided heat-related deaths following the implementation of the heat action plan. And then national level guidance came in 2016 when the National Disaster Management Authority developed guidelines for preparation of heat action plans. And subsequently following that, the guidelines have been revised. And now more and more states and cities are working on developing their heat action plans. And in 2024-25, CEEW as well started supporting cities on developing heat action plans as the primary policy instrument. I mean, what we realize is that there is a significant gap in the current level of preparedness, where only 60% of the HAPs, like more than 60% of the HAPs, the heat action plans, they lack localized heat hazard mapping and info on humidity and warm nights, which, as I mentioned earlier, we identified as the key kind of factors affecting heat risk. And also around 95% of the heat action plans lacked vulnerability and risk assessments, and they were primarily only looking at the changing patterns in temperature and extreme heat. And the fact of the matter is that this is a significant undertaking. There are over 4,500 cities in India, and we of the back of the envelope calculation tells us that it would take nearly 10 to 12 years to develop heat action plans for all of those cities, with an estimated cost of more than 720 crore Indian rupees. So definitely it is a significant undertaking, but accordingly we have to kind of understand that we cannot do this in a piecemeal fashion, where doing it sequentially, where we have one city after the other developing heat action plans, but we need to significantly expedite this process. And therefore, we started looking into kind of ways in which we can automate some of this development of heat action plans. And we took the challenge of creating and supporting 300 cities in India across 23 heat wave prone states in developing heat action plans by the end of 2027. And so far, I'm happy to share with you that we have supported more than 150 Indian cities and districts by 2026 in developing their heat action plans. And by the end of 2027, we plan to support 150 more therefore hitting a significant benchmark in terms of volume, and as I'll share later, in terms of the quality of the methodology and the approach towards heat action plans as well. So this is, in part due to some of the automation techniques that we utilized. We realized that, when we have these guidelines coming from the center, a lot of it can be standardized and templatized, so that it expedites significantly the time taken for developing heat action plans. Now, our basic philosophy in this, in the development of these HAPs is that they are based on a data-driven hyper-local assessment of heat risk, and trying to address these three questions of when to take action, where to take action, and what action to take. So when we talk about when to take action, it is, we have developed kind of heat thresholds based on biometeorological thermal indices, which include dry heat thresholds and also felt heat thresholds, which kind of set this yellow alert, orange alert, red alert type thresholds, which allows decision makers and practitioners to issue appropriate warnings and take appropriate actions, both in terms of early warnings and also protective measures that they can take. In terms of where to take action, as I mentioned earlier, several HAPs developed earlier did not have a hyperlocal assessment of climate risk. And this is where kind of in-house methodology developed at CEEW, we were able to utilize that and utilize this indicator-based approach and index-based approach to do very hyperlocal analysis of extreme heat, where we looked at several indicators, following the IPCC definition of risk, which has hazard, exposure, and vulnerability, and having several indicators under each of these categories to develop granular information to allow decision makers again to identify what are those key high heat risk areas which should be prioritized for action. And then finally, what type of actions to take. So we talk about in the heat action plans the need to prepare and respond timely, and to redesign cities, taking kind of systemic changes on how to build heat resilience. And then also talking about financial instruments and insurance related instruments that can be utilized to protect the lives and livelihoods. So I'm just pointing out here some of the solutions that we suggest in the heat action plans, including heat health early warning systems, health sector preparedness, health infrastructure preparedness. And what we also find is that during the times of disasters, if your healthcare infrastructure is not resilient to those disasters, then it of course becomes a bottleneck where it cannot service the population that needs care during extreme events. So we also take a holistic approach when talking about the health sector, that it is also enhancing resilience of the healthcare infrastructure so that it is available for the populations when during the time of disasters. And then finally, talking about insurance related mechanisms such as parametric heat insurance, where again in India there have been several pilots that have been done on parametric insurance models, and many of them are related to heat related insurance, particularly for daily wage workers, outdoor workers, and vulnerable populations. But the challenge is that many of these pilots are just that, they are just pilots, and it is difficult to kind of scale up those pilots into large scale solutions. So what are the challenges there, and how can we kind of develop solutions that can then scale and benefit as many people as possible? Now, I understand that the subject of the conference is about AI and using technology and AI for mitigating urban heat and other climate-related challenges. So just talking about some of the tools that we are developing at CEEW to support this process. Over the last few years, including our study on heat risk index, we've also conducted studies on extreme weather events, hotspots across the country. In 2023, we published a study on changes in monsoon patterns across the country. And the idea was that, okay, all of this information, it's something that, when the decision makers need this information, the tendency is that every time they start all over again and they have to, hire consultants, hire experts to do this type of analysis. And then a few years later, then the cycle starts all over again. So we realized that there wasn't really a platform which allows decision makers and policy makers to access this information in a free to use and easy to understand manner. And so we wanted to use all of our expertise from the last few years and put all of this information out there for people to use. And so in late April, we launched this platform called Kravis, which is Climate Resilience Analytics and Visualization Intelligence System, which is quite a mouthful. So we just generally go with the short form Kravis. This Kravis platform, understanding this need of the ecosystem that, as Dr. Saurabh earlier and Kathy was also saying, that there is no dearth of data. Data exists. And we see that in India as well, where there are organizations that have climate related data. There are sectoral line ministries and departments that have sector level information. And then there are research organizations such as ourselves and also academic institutions that do good work. They have all these models, they have data sets that they produce. And all of this exists, but there isn't really a platform that allows users to access all this information. And therefore, in Kravis, we wanted to integrate all of this in a manner which can be, again, easy to use and free to access. So we in Kravis, you can access the platform, and it's kravis.ai. So it is an all India platform which has 3 layers. It has a visualization platform which allows you to visualize climate trends from past trends to current changes and future projections. And also allows you to overlap climate data with sectoral information to then take action appropriately for different use cases. And then we have also integrated a agentic AI layer on top of this, the visualization platform, which allows basically non-experts, non-climate experts to be able to engage with the platform, interact with the platform through conversational queries, just as you would with a chatbot. However, the key difference is that between this and any other kind of, the ChatGPTs and the Geminis of the world, is that while those general purpose chatbots are accessing information from all over the internet, the AI agent built into Kravis only access the climate data and information that we have provided. So we have kind of limited the universe of data available to the platform, which reduces the chances of hallucinations and giving incorrect information. So this really bridges the gap between researchers, academics, consultants, governments, businesses, and people that want to engage with climate data, utilize climate data for their for their decision making, whether it's for early warning systems or hyperlocal risk assessments, or even decisions around investments and portfolio management. Is that 2 minutes? Sorry.
Yes, that's my sign for
Okay.
last 2 minutes.
Great. I'm almost done. So I wanted to share this with you. In addition to heat, of course, it also has other climate-related hazards and other applications in different sectors. But because this conference is about AI tools and using technologies, and what Saurabh and Dr. Saurabh and Kathy said, we are precisely trying to address that problem. That how can a decision maker access this information and then use it in their different use cases. So this is just a snapshot of that AI layer, where this is just a sample query. You can think of many more complex queries, where if I ask, give me the top 5 states that are expected to have high temperatures in the year 2040, then it will utilize kind of climate model projections that we have provided, and it can return back to you charts and maps and graphs that can be directly used for different use cases. Finally, what I wanted to share here is, another recent development that we recently launched the South Asia hub of the Global Heat Health Information Network, which is an initiative of the WHO and WMO. So this, CEEW, along with our consortium partners, the NRDC, Sustainable Futures Collaborative, and United Nations, UNESCAP, we had pitched for this South Asia hub to be based in India, and we were selected in that bid. And so CEEW is the host for this South Asia hub for heat health information network, where some of the key kind of focus areas and the pillars of the hub is divided across these four working groups, which are on heat health planning, on heat and cooling, on heat at work, and heat and governance. So I'll just pause here for a minute. You can kind of read through it, but the idea is to support studies, support risk mapping, and really build that information and intelligence network that can be used by countries in South Asia for effective decision making. And then the goals are to create a network of institutions, deliver on open access data sets, capacity building and trainings, and also policy frameworks and heat action plans, taking some of our learnings from India and sharing that with other countries in South Asia, and supporting financial instruments and scaling up finance for heat-related responses as well. This is my last slide, talking about some of our other ongoing initiatives at the intersection of climate, heat, and health. I already mentioned the South Asia Heat Health Hub, but we're also working with the National Program on Climate Change and Human Health, which is an initiative of the Ministry of Health, and a heat climate change and health roadmap for India. There's also kind of subnational level initiatives and engagements in Tamil Nadu, in Maharashtra, where we are supporting the state governments in in a One Health program, in operationalizing the state action plans on climate change. Just kind of giving you an overview of some of our other ongoing initiatives. As I mentioned, we are taking a holistic approach where we see that the health systems need to be prepared to be able to better respond to the urgency of climate change and extreme heat by making themselves more resilient as well. And so these are some of the initiatives that talk about that. That was my last slide. Thank you again very much for the invitation, and thank you for your patient listening.
Thank you, Dr. Bajaj. It was really a very interesting and deep dive into how you are handling this situation through CEEW in India with all the technological aspects of it. So thank you very much for your presentation.